What comes to your mind when you see this little girl? Without knowing anything about her, do you think you can make any accurate assumptions? People are quick to judge others based on what they see, not based off of what they know. Would you believe me if I told you that people often described her as weird, incompetent, a freak of nature, or defective, although they too do not know anything about her? She, like many others, was insulted for being different. This little girl was me 1 year after my onset of stuttering, and at the time that my disfluencies began to impact my communication and self-esteem. Throughout first grade, my speech gradually became choppier, but I didn't know why. My mouth involuntarily made me repeat sounds, extend parts of words longer than I wanted, and didn't allow me to speak at all since my mouth was tense and I felt that I couldn't breathe. According to the American Speech, Language, and Hearing Association, a fluency disorder is an interruption of the flow of speech characterized by atypical rate, rhythm, and disfluencies, which may also be accompanied by excessive tension, speaking avoidance, struggle behaviors, and secondary mannerisms. Since others have perceived me as different, weird, and unintelligent because of my stutter, I viewed it as a negative attribute that holds me back. Negative feelings associated with stuttering contribute to mental health issues, such as social anxiety and depression. Although anxiety does not cause stuttering directly, strong feelings can increase the number of disfluencies. When I stuttered around people, it caused me to be more anxious, which caused me to stutter more, which caused me to be even more anxious and self-conscious. You can imagine my horror when I realized that I would be stuck in this cycle at least through high school, but also into college in my professional career. I was enrolled in speech therapy for 8 years to help me overcome and hide my stutter so I could fit in with my classmates. In the earlier years of therapy, I was taught techniques to overcome my disfluencies in the moment of stuttering. I was told that being different is not okay, and you must do everything you can to hide your stutter, even if that strips you of your identity and yourself. As a kid, I was told to fit in with my peers since kids prey on difference. I was told to try to sound normal. But what is normal? Everybody tells me to be normal, but no two people are the same. How can I strive to be something that's unobtainable, as it's only a concept? If everybody can be normal, then there's no variety. Normal cannot exist if we want to be unique, complete humans, not faceless mannequins that lack any difference. Since I had a family history of stuttering, onset at the age of 6, anxiety related to speaking, and numerous secondary factors, such as facial grimacing, avoidance of eye contact, and pain in my chest and throat, I was at high risk to continue stuttering into adulthood. Stuttering persists into adulthood for approximately 1% of children, even after speech intervention. If a person stutters chronically, they will continue to deal with the symptoms of stuttering throughout their entire life. I am a chronic stutter, although I attempt to pass as a fluent speaker, so my conversational partners will never know I stutter. When concealing my stuttering is not possible, I try to change the subject or forget what I was going to say as I strive to appear normal. In later years of therapy, I practiced stuttering modification and shaping techniques, but they only helped me some of the time. If I'm still struggling with the cycle of embarrassment and anxiety, then I can't be my true, unapologetic self who accepts my stutter. So, I brainstorm with my mom, who's also a chronic stutterer, to determine what techniques that I can use for the rest of my life. I paid attention to how my body feels, what emotions I have, and what's going through my head before I begin to stutter. I can usually sense when I'm going to stutter about 5 to 7 words before I actually get to that word. So I change what I was going to say before people can even tell I'm being disfluent. Apparently, most people don't map out their sentences before they speak the way I do. When I'm talking, It's like I'm constantly drafting a text message, and there's some words I don't know how to spell. When I don't know how to spell a word, I have to go back and think of a word that's easier. But instead of not knowing how to spell, I have a stutter that I'm constantly trying to mask. If I feel a block is going to happen, I stop what I'm saying and I abandon the topic completely. Stuttering is also like driving on a road covered in debris. In the lane I'm driving in, I can see that the path is bumpy ahead. I could continue on that path anyways, even though I will have to slow down and experience bumps, or I can find a different route where I might not have to slow down and possibly hurt myself. The paths represent my intended sentence, while the debris represents my disfluencies. If I take another path and draft another sentence, I'll sound more fluent. If I choose to stay on my intended path and choose to say the word that I might stutter on, I face my disfluencies head on and I say exactly what I want to. But since I was taught to sound fluent in speech therapy, I'll typically change what I want to say or abandon my thought completely, which may steer me down a path that I didn't want to take. This task of constantly monitoring my speech is both mentally and physically exhausting. Recently, an SLP said something to me that really resonated. She said, "Imagine you woke up tomorrow and your fluency was normal. You no longer have a stutter or any stuttering-like disfluencies. What would you do differently that you can't do with a stutter?" My first thought was that I'd go out in public and start conversations with people. Since I stutter, I don't talk to people I don't know, even if I desperately want to say something. I would compliment a stranger on the street. I would speak to more people and ask if they need help. I'd happily speak at conferences and conventions to express my ideas. I could think of so many situations that I would put myself into that I can't because I stutter. Overall, I'd be happier, more comfortable with myself, and less fearful of socializing if I woke up fluent tomorrow. After a few moments of silence, she said, "Why can't you do any of that? There's nothing holding us back from doing anything that we thought of. My physical disfluencies do not stop me from complimenting strangers on the street, speaking in a conference, or socializing at conventions with large numbers of people." Since many people who stutter have been judged or ridiculed at some point in their life, they internalize the stigma that they're of lesser value than fluent speakers, even when society is no longer judging them. A person who stutters becomes aware of, agrees with, and applies those negative views to themselves and others who stutter. Repetitions, prolongations, and blocks are not what holds people back from social interactions, but the learned responses and emotions tied to stuttering and the judgment of others, which creates anxiety towards social situations. Chronic stuttering cannot be cured or completely treated, so an effective speech therapy goal would be to make the patient more comfortable with their fluency in everyday situations. Instead of focusing on reducing the number of disfluencies, making a person more comfortable with their fluency is helpful for both mental health and self-acceptance. Even though I knew I would never overcome my stutter, my elementary speech teachers attempted to make my fluency appear typical, but did not address my negative mental attitudes towards my speech. This made me apprehensive about speaking to people, as I was afraid of being judged. If I was told in my childhood that it's okay to stutter, I wouldn't be as anxious and reserved as I am. About a year ago, I enrolled in the Speech and Hearing Science program at ASU. When learning about stuttering in one of my courses, I was informed that it's not wrong to stutter. If I'm comfortable with my disfluencies, that's all that matters. Fluency disorders may not be curable or fixable, so we must learn to accept our differences and advocate for ourselves. People who stutter and who are different will always be judged in their lives, but we must learn how to be confident with ourselves since we cannot change and should not change who we are.